All right, I'd like to introduce Steve Voschel. Steve is here to talk to us about the Affordable Care Act, or otherwise known as Obamacare. Steve is the president and owner of Financial Benefit Group Incorporated and has been helping clients meet their financial needs and goals for over 20 years. He graduated from the University of Georgia's Terry College of Business in 1989 with a BBA in Risk Management and Insurance. He's a chartered life underwriter and a chartered financial consultant. Financial Benefit Group is a full-service insurance and investment company which has been helping Forsyth County individuals and businesses meet their financial goals and insurance needs since 1997. Financial Benefit Group specializes in areas of individual health, Medicare insurance, employee benefits, investments, life and disability insurance, and financial planning. In order to focus on these specialties, they're split into two divisions, a health insurance and benefits, employee benefits division, and an investment and financial advisory division. They provide health insurance for hundreds of individuals, families, and local businesses. They also provide investment advisory services. Financial Benefit Group was named to the Bulldog 100 in 2011 and 2012. The Bulldog 100 Awards are for the 100 fastest growing University of Georgia alumni-owned businesses. So Steve is very involved in local community. He's a 2003 graduate of Leadership Forsyth and was recognized by the Forsyth County News in 2005 in their Men of Forsyth edition. He served on the United Way of Forsyth County for 4 years and was the campaign fundraiser chair in 2007. Steve was a member of the South Forsyth Rotary Club from 2000 to 2013 and founded the Forsyth County Tea Party in 2009 and sits on the leadership board. In 2012, he ran for and almost won his race for state senator against Jack Murphy here in Forsyth. Lost by less than 0.5%. So, just to set the expectation, Steve is not here to talk about the political aspects of Obamacare. Okay, that's not what this is about. He's here to talk about how Obamacare is going to be implemented and how it is going to actually affect people and what they're going to have to do to go about getting enrolled and things of that nature. So, Steve, thanks very much. Thank you.
Well, I've got a lot of friends in the room, but it's always good to tell people what I do for a living because, as my daughter said the other day, I want you to come talk about the business you bought. I'm like, well, you do understand that I started with 0 clients, don't you? She's like, no, I thought you bought a business. So even your own kids, sometimes don't understand exactly what you do for a living. And it's when you're in the insurance business, relatives a lot of times are always the last to fully understand what you do because you just assume that they know what you do. You guys know me from my Tea Party hat and my volunteer work that I've done here, but I do have a real job that pays the bills, and my real job, and has been straight out of college, is that of an insurance agent, life insurance agent, going into full service lines, then investments, and then in 2006 I hired the brains of the operation, my wife. So she really, Stacy, really runs the individual health side of it. I might oversee the staff and everything, but on the day-to-day stuff on the health insurance, she's the expert on all that, so that's why she's here. In case I get stumped on a question, I got my expert. So the disclaimer and the assumption on tonight's presentation, as Sal said, this is not to talk about the political part, the defunding, or anything else. We're going under the assumption that this happens come October 1. All right, so if this happens, we're having to go through hundreds of hours of classes and meetings with all the carriers and the government over and over and over and over. And one of the few things that differentiates the carriers now that there's no underwriting are their directories, their plan design, which is even that's been minimized, but it's their premiums. So they're not even telling us their premiums right now because they don't want to know the competition enough. So they're not going to tell us premiums, I'm willing to bet, until the last week in September. But I am willing to bet a lot of money, the premiums are going up. So that I'm certain of. So the idea, the hope, the big hope, and the idea of the Affordable Care Act was to provide greater access to health care. Basically, 11% increase of those that are covered. 86% have insurance already. It's that 11%, and the rest of them aren't going to get it no matter what you do to them. Even if you find them, they're not going to get it. So 37 million currently have no health insurance, not counting any illegals. Obamacare intended to really bring equality to the federal poverty level across state lines by increasing it. Right now, every state has a different number, and what they wanted to do was raise it to 138% of the federal poverty level. So if you're below that threshold, you can get on a Medicaid program or a CHIP program for the kids. And then above that, all the way up to 400% of the federal poverty level, they're going to have some kind of a subsidy program and even a cost-sharing program on your deductible copays and out-of-pockets. Currently, 70% of the states, and when I write my notes, sometimes I can't read my own notes if I don't have my glasses on, but currently 70% of the states are at 100% of federal poverty level or below. So it's pretty astounding. There's very few that are above it. Georgia was at 50% of the federal poverty level. That has been increased. Now the court system threw out the fact that you have to go up to 138, so different states now can choose. Georgia has chosen to go up to 100%. The feds will pay, and they differentiate, the kicker that the states are having problems with, if somebody is currently eligible for Medicaid in the state, but they're not on, because many of them aren't on it. Even though they're eligible, they're simply just not on it for any number of reasons. But if they get on that plan, Georgia still has to pay the normal 57% that they pay right now. If they get on under the new numbers, then the federal government is going to pay right around 93%, something like that, up until 2019, and then they turn it all, they give that big whopping bill, which is about $14.5 billion back to Georgia. So our budget's 20 billion? 20 billion. We're going to spend from now until 2019 about 714 million more, to estimated, to cover 500,000 additional Medicaid recipients. But in 2020, we get the real deal. The shackles are off, and the federal government now has now you're taking money and you're on the system. And what are you going to do? As a politician, are you going to pull away benefits from 1 million people? I don't think you will. You're going to vote for it. You're going to vote for that expansion. So they know what they're doing. They're building it to get you involved, and then once they've got you involved, then you're on the system and you're part of it. California has recently opened their doors ahead of time to these numbers, and they've already had 400,000 new recipients sign up. If there was an interesting article that I did when I was doing research on this, but Georgia right now, if you don't have dependent children below a poverty, and you're below the poverty level, you're not able to get on Medicaid. So Georgia's quite low. We're probably towards the bottom third, but you got Alabama, Arkansas, some other ones that are much, much, much lower. So there's always a yin and a yang in politics. This is the yang because of the yin, So we've gone the other way in the state. Now we don't have control of the powers anymore, and we're being forced to do this. One of the good things that I'm happy to see is no medical underwriting and the elimination of pre-existing conditions. As an insurance agent, it drives me crazy when somebody comes in with a health condition. And it doesn't have to be a very big health condition. It could be seasonal allergies that your doctor says is asthma. You're going to get kicked out. It could be a knee, bone on bone in your knee. They're going to deny you. We would spend half of our time in the process of trying to find you a carrier, because the carriers were playing this little game. So again, it's the yin and the yang. Now they don't get to do that anymore, but you're going to see premiums going up. Not necessarily because, I mean, that's definitely going to drive it up some. There's also not going to be any lifetime limits on benefits. So no more, if you're paraplegic or have a terrible burn, those are some of the bigger claims, maybe an ongoing disease that lasts for a long, long time. You're not going to be able to outlive your benefit. It's not ever going to be a lifetime benefit. Now, their attempt to rein in costs, from everything that I can see, are best case guesstimates from anything that I've read. They're going to move away from the fee-for-service system. They're not doing a whole lot of, they're trying to form these accountability care organizations, which are basically another name for an HMO. It's an HMO with a different name. You know, they want to put hospitals, doctors, primaries, specialists, wrap them all in. I've seen things where they want to pay you a lump sum per patient up front and then expect you to maintain that benefit, you know, maintain that service to that client even after the money runs out. Well, I don't want to be that client when the money runs out, because I'm sure all the appointments will be full after that point. The most disturbing thing out of it is they're forming dozens and dozens and dozens of more big government. There's going to be more departments, more boards, more committees. They're growing in astronomically. They're adding 20,000 IRS agents. They're forming what's called an advisory board, of independent payment advisory board, which is basically going to be the healthcare version of the Federal Reserve. It's handpicked by the people that will be on it. Will be handpicked by the president, and the only way to overrule it is going to be a supermajority in the Senate, which you'll never get. They, moving forward, will be the ones that will decide what happens in healthcare. You know, and that's just not a very pretty thing when we had, you know, probably the best healthcare system in the world, albeit maybe not the cheapest. Certainly has some issues with it, but it could have been tweaked easily and made into a much better system. They're going to add benefits in consumer protection. So they create some many new consumer safeguards. The donut hole for seniors goes away in 2020. For prescriptions, it starts prevention and wellness programs. It mandates 10 essential benefits on all plans on the individual side, whether it's on the federal exchange or on the private exchanges. And these are in front of you. The 10 essentials are in front of you. But the three biggies that are going to really drive costs, I mean, a lot of these are things that you already have: outpatient care, emergency care, hospitalization, prescription drugs, labs, preventative. That's already on there. So, I mean, most real plans have that anyways. But it is throwing maternity and newborn care on all policies, even if you're a single male. It's throwing mental health and substance abuse, which currently is not covered on individual and is greatly limited on small groups. It's throwing it on there at a much higher level, and that's going to definitely drive cost. And then it adds pediatric services, including dental and vision care for children. So those, maternity, mental health, and pediatric, are going to be the three that are going to drive the cost the most. You won't be able to have, if you're a senior 64, if you're 64 or older, you're not going to be able to be charged, if you're not on a Medicare supplement, you're not going to be able to be charged more than 300% of what a 21-year-old male gets charged. So where a 21-year-old male would normally be $120, a 64-year-old male would normally be about $650. That scenario is going to change. Well, that $650 is not going to be lowered. $650 is going to probably go to $750, and they're going to raise the 21-year-old male, who is now going to be mandated that he has to buy the insurance.
And the penalty if he doesn't buy the insurance is?
I'll get to it. Yeah. So you're gonna see that. So people who are currently uninsurable due to pre-existing conditions, they're going to obviously benefit a lot. They're now going to be able to get insurance. Companies that are high-risk companies are going to benefit because now they can basically do away with their group coverage and their employees can go on to individual coverage. Your low-income, blue-collar businesses will probably all do away with their group coverages, and you'll see them go on to individual coverages. You're going to see probably 25% of small groups under 10 lives. Those will be the ones that will probably have the largest effect with individual health, because the real benefit of being on group health has always been you didn't have pre-existing conditions. You normally didn't have a lifetime limit, and you were able to get maternity. Well, now you can accomplish all those with the individual. So the real benefit, there's no reason to pay that additional cost of a group and all the hassle of an employer having to deal with it if you can just let your employees go on the exchange. You're going to see and hear, because unlike an insurance company that has a finite amount of money for marketing, you're going to see the federal government throwing money at this on the news channels and on the mailers. I mean, you see how much you get from Medicare Advantage and for the insurance products. You're going to get inundated with email blasts. I mean, they're throwing everything at this. They're giving grants to hospitals and outpatient facilities and nonprofits to do enrollments to get, if they don't get enough people signed up for this, they're going to fall flat on their face. And so and more importantly, if they don't get enough poor people on this, they're going to have a very difficult time explaining what happened. So those of us that have insurance are going to continue to have insurance. It might not be exactly what you want or what you want to pay, but it's really, this whole thing was designed to get people on it that don't have it. And a lot of them don't have it because they just haven't had the gumption to go out and get it. So they're doing everything they can to motivate those people. If you look, so 84%, this was astounding to me, 84% of the estimated $1 trillion that this is going to cost over the next several years, 84% of that strictly goes to target Medicaid recipients in the uninsured with an adjusted gross income of under 400% of the federal poverty level. More so, 250% of the federal poverty level, which is a family of four in the sheet in front of you. 58,875 is a family of four. So if you're at that level, what we're being told, if you're at that level or lower, if you can go on and you can go to agents, or you can try to navigate it yourself, but it's kind of like the 1040 easy. There's nothing easy about this whole application. So the one form I saw was 14 pages. So if you get through it, it's just easier to call somebody who does it for a living. It's not, the premiums don't change having an agent involved, and at least you'll have somebody who's probably done it 15 or 20 times ahead of you. But if they're based on your income and a number of other factors, location, zip code, and that, you will qualify for one of 5 different plans: the bronze, silver, gold, 4 plans, and the platinum. Not all, and this is on the federal marketplace exchange, not all carriers are on that. So there's a very small number of carriers that have chosen to even be on that. Outside of that, you can go out into the private marketplace and you can go and get insurance through the carriers, but they are still going to be mandated to provide these same benefits and the same overall benefit package. You might have a better list of doctors, you might have more plan options, which you'll be paying a lot more for, but you'll still have no underwriting, you'll still have all the other scope of things protecting you. And for most of us, that's probably what we'll be doing. But if you're in that 250 range, not only will you probably get a 93% subsidy or greater of your premium, but they're probably also going to subsidize your deductible and your out-of-pockets. Out-of-pockets, to me, the devil's in the detail on out-of-pockets. Out-of-pockets have always been, no one thinks they're going to hit it until you have a claim. That 20% goes really quick when you have a $50,000 claim. So I've never been a real big lover of more than $3,000 out of pocket plus maybe a $3,000 deductible. These things are going to $6,800, $6,350 on the individual and over $12,000 on the family out of pocket. Now that includes your deductible and all your co-pays, but still, that's a lot of money for your average person to have to pull out of savings if they have it in savings. The other 16% of that trillion goes for all other programs. It's astounding. Medicare is actually going to be dinged about 50 million plus every year for the entire existence, and that'll probably grow as they're shifting money from Medicare to Medicaid. There's 3 ways to to purchase individual health insurance. The one I told you about was the federal marketplace. The exchange is what you've heard it called. They decided they didn't like the exchange name. Now it's the marketplace. So the federal marketplace, I'm going to fast forward here a little bit, but out of all my favorite things that I literally spit out my coffee laughing about was the mandate. They don't call it the mandate. They call it the shared responsibility payment. You know, if we do that in the insurance business, we most definitely get sued or fined for some kind of ethics or something. But the politicians that, you know, they're calling it the shared responsibility payment. If you have group coverage and you pay more than 9.5% of your salary for that benefit, which, and it's not for your whole family, it's for your benefit on your salary. If you pay more than 9.5% for it, then you are eligible to get onto the exchange. Otherwise, if you have employee group health insurance, you are not eligible to be on the exchange. So that's going to rattle a few people because they're all thinking they can get on and they're going to be in for a real
Can you
surprise.
not drop that out of your group health care plan at work and buy the exchange? It's cheaper if you're a young single male.
That's not what I'm being told. If he's eligible for it, he's eligible for it, and he's being given the chance. He's not going to be eligible for the exchange unless it's more than 9.5%.
So when he fills out his exchange paperwork, they ask if he's got a plan at work. If he
Yep.
says yes, they're going to deny the exchange. He's got to go back to his work plan.
Yep. I mean, look, if I answer questions now, we'll never get through this because I've already done this once and it didn't work. All right, so that's the one big kicker there. The private markets. Now he could drop off of the group plan and go on a private exchange, private market through the insurance companies, but he's not going to get government subsidies. The government is not going to pay for a subsidy to anyone who is eligible for a group plan, regardless of the size of the group plan. That doesn't have to be the 50 and up. The 50 and up, they postponed that. They were going to be mandated that they had to pay at least if they had more than 30 employees jump off their group plan because they were paying more than 9.5%, they were going to be fined per employee. And it escalated over time, $2,000-3,000 per employee. So it would, a 50-person group would have a hard time having that happen, but 100 or 200, you could easily see that being a problem. If you're in Mississippi or something, you can see where you're going to get that's why they were all raising Cain about it, and that's why they went ahead and postponed it. Well, a lot of it raising Cain was the unions. So that's why there was something like 1,600 special postponements, and finally they just said, we're postponing the whole thing. So the private markets will still be there. Humana, all the carriers are still going to be doing the private markets, but not all the carriers will be in the exchanges. So, all right. The plan designs as you know them today will not be the same next year. Government Medicaid, anything under 100 in Georgia, anything under 100% of federal poverty level will be you will be shifted when you go through the process. You will be shifted to a federal program, and then above that they'll tell you what your it's kind of like going to a department store that says they're having a sale, but they're going to raise everything 50%, and then they're going to discount off that. So yeah, you're going to get some subsidies, but the premium's going to be higher than it is right now. And the plan that they're basing off of is the bronze on the federal. The bronze or silver? Silver.
Yeah. You
So-
only get the,
So that's a 70-30 plan. I mean, that's not going to be any. I mean, that's going to be a pretty bare bones. You're you're at 30% co-insurance. You're going to hit that out of pocket really fast, even if you had just gallbladder or something simple. You're going to go through that. MRIs, things that right now we pay co-pays for, it's going away. It's going towards your deductible. So they're going to come out and guarantee you, mark my words, they'll come out next year and say, we've lowered utilization. And they will, because once people figure out that they're going to have to pay $3,000 for an MRI, that suddenly it's not going to be any more important. They're going to limp around for a while before they go to the doctor and get that done. Because right now they get it done and you don't think anything about it because you pay a $100 copay, on a lot of plans where that whole process goes away. The other big thing is the open enrollment for this whole thing starts October 1st. And it was initially designed to end December 15th. Everything will be effective January 1, 2014. But they realized that they're government workers and that ruins their Christmas 3-week vacation. So they extended it through the end of March this year. But even if you did it effective April 1, everything will renew March 1 of next year. And the craziness of it is the entire country will be renewing January 1 moving forward, with the postal workers telling you how to, I don't mean to bash on postal workers, but government workers. If your income goes up, you're supposed to call them and tell them that your income has gone up and that you no longer make as low as you used to make, so you might be on for a lower amount, and you actually, you're supposed to call them. You're supposed to call them. I'm sure that somebody will be answering that phone with 187 million people calling. So the other thing that we're being told is that this is going to be, whether you're in the exchange or in the private marketplace, this open enrollment is the open enrollment. This will be the only time that you can buy insurance this year. You can't come in June without a qualifying event and go to somebody and say, I want to get insurance. You can get on a group plan, but you're not going to be able, and if you don't pay your payments, they're going to have some leniency on the payments, but if you don't pay your payments, that you're not going to be able to get back onto open enrollment. So it's going to be a real eye-opener for some people on that. There's going to be some people that aren't going to get it done, and that's the big reason why I'm doing these presentations, is to educate people on it, because what you hear on the news will be, they'll do their best to explain this stuff, but it's going to get very, very blurred on what is actually happening. I mean, I'm getting it from the horse's mouth, and there's about 15 horses running around, and they're all talking different languages, and it's still confusing as daylights.
Maybe it's not the horse's mouth.
Not the ass's mouth, it's the horse's mouth. So the thing that we're advising people is, if you think you fall in these income levels, then the best thing to do is call your insurance agent and go through them. If they're on the national list, I mean, they have to be licensed and stuff and appointed with each carrier, but they also have to go through HHS and CMS, the departments that handle all this. The premium cost doesn't change, but you have a much better chance of figuring that out. And then on the group side, the small group side, SHOP, which was Small Business Health Options Program, we had been told it was done away with. And then as recently as just a couple weeks ago, it's, in fact, while we're taking the class, it's in the class. And I'm like, why is it in the class if it's not going to be here? And so when we started checking, I mean, we knew stuff that carriers didn't seem to know. And that is, it's there, it's been minimized. You can only pick one plan as an employer, where it was designed before you could pick multiple plans with multiple different carriers, and then your employees could go in there and pick it. It's all this wonderful stuff. But the devil's always in the detail, and they don't, because they've never done this in real life, they don't understand these details. So once they started figuring this out, they realized they couldn't do it. So but now they are doing email blasts to my clients, and I'm sure you're hearing it too, saying that you're eligible for tax incentives as a small group employer. So, but when you research into that further, you have to really average about 25,000 an employee. If you go above that, they say you can go up to 50, but you're not going to get more than half of the employer match. So if I match half of 250, 125 a month, I'll get half of that back as an incentive if I meet their criteria, but I can only pick one plan. So your very, very poor groups, typically your blue collars, might do this, but at the minute that employer does that, because he's offering group coverage to his employees, he just cut their throats. Because they would be much better off if they make that little bit of money for him just to do away with the group and let them go on the exchange. They'll get 93% paid for. So it doesn't. I don't understand the whole thing, why they're doing this, but that's kind of, it contradicts what they're trying to accomplish with the federal marketplace. So, and of course, as always, it excludes the owner, S corps, sole proprietors, owners, and, you know, so family members of owners. See, there's no way in there that I can see that anyone could circumvent it as an owner. You're not going to be able to pull it off. You can't put mom on there and somehow say, I mean, you can, just like you can do tax fraud, but when you get caught, you're going to jail for it. So the shop is probably the most confusing thing out there, and somehow they've got email blasts for employers. I guess they got it off your tax returns or something, but they are pounding these things out, and I get a lot of calls on it. But most carriers, most groups have two options nowadays: high deductible option, a low deductible option. If they go on the shop, you've got one option, and one carrier. The premiums are not going to be cheaper. They're probably going to, in fact, what a lot of carriers are allowing us to do now is renew our groups early. So if I renew a group now in December, even though they might be a July of next year renewal, at least they'll be able to keep that plan until next December. And then that gives the government 12 months to figure out what in the world they're doing. At least the employer and the employees know what they've got. And they're even doing that on individuals now. So I think, as Pelosi said, just you got to pass it, then you can read it. Well, now people are reading it. Even the unions are starting to read it, and they're starting to be shocked with what they're reading. And where carriers would never allow us to renew early like that. They're all, especially on group individuals, they're letting us do it now to keep clients with some kind of sanity on what's happening. Let's see. I told you the large group mandate was postponed. So the shared responsibility payment, let's talk about that. The mandate. So it's very similar. Massachusetts has one like this. It's very similar to that. Many insurers don't have coverage because of a number of things. One, it's too expensive. Two, they're young, they're healthy, they don't want to spend it. They have the invincible thing going on. And three, they'd rather spend their money elsewhere. That's their choice. So the mandate makes them do that. If the penalty steps up, but initially it's 1% of income with a 285 max or a flat $95 in 2014, greater of. The next year it goes to 2.5% of income or a $2,085 max or a flat $695 by 2016. And then it goes a $50,000 income, I just put this in here, would result in a penalty of about $1,250. That's still going to be a lot lower than what you're going to pay on a premium. I mean, they're probably, and if they're not even doing a tax return, why do they care? I mean, so this is not going to bring in as much as I think they're hoping it's going to bring in. I mean, because these premiums are changing.
I heard that if you do not get a refund from the IRS, in other words, you arrange it so that you have to pay at the end of the year instead of getting a refund, that the IRS actually has no way to collect that penalty fee. That the only way they can collect it is by deducting it from your refund.
There's a lot of things that are on the honor system with this whole thing. If you smoke, you get the one thing they can raise your rate on, health-wise, is smoker rate. So smoker rate's 50% rate up. Now, if you agree to take a smoking cessation class, they waive that. Whether you take it or not, it's the honor program. Whether or not you even tell them you smoke is an honor program. I guess they
Exactly true.
have to pull your medical records and see that you.
They are collecting data from physicians, social and behavioral data now. And that's gonna be at least the least of what they collect.
Yeah.
Yes.
So it's the common
Don't
You
cold.
tell
got
your-
nicotine in your blood, right?
Don't tell your physician you have guns in your house either.
Oh yeah, they want to
Just
know.
saying, this is
They
what
asked.
you're-
Didn't they ask the kids
The
that?
pediatricians.
Pediatricians.
Pediatricians ask
They ask the
regularly.
kids.
I heard they were going to start
Pediatricians
collecting
ask
BMI
kids.
information too.
I informed.
BMI, body mass indicator, or index. Yeah.
So it's gonna, they're gonna gather as much information as possible, just like Common Core was intended on the kids in school, and it's going to be a very interesting fourth quarter. All right, questions?
What do you think our rate increase is gonna be? That's the number one question I'm getting. Where are rates gonna be? What's our plan choices gonna be?
And what I'm telling people is if you're older, you're probably gonna see your rate go down.
Really?
If you're a young male, get ready for it. It's coming. Because it's gonna go up.
What if you have a group plan? You know, the trend's 18%.
If you got an unhealthy older group, you're gonna be looking pretty good. If you've got a younger, healthy group, especially younger people, you're gonna get dinged.
Steve, us seniors, what's this gonna do to us? I mean, I've already had the problem today with them.
And the thing I didn't talk about at all is access. Because if the other side of this, and you just bring a doctor in here to talk about it, but the doctors that I'm talking to, I mean, they are, if they're close to retiring, they're gonna retire. I mean,
Well, I've asked every one of my doctors, you know, what are you gonna do? And they said, we don't know, but we'll tell you as soon as we decide.
once the bills start happening, and once they start seeing how they're gonna get dinged, they don't have to, one thing they do is they don't force anyone to do anything other than get on the insurance, but they're not forcing me to work for free, and they're not forcing a doctor to work for free. So eventually, they're just gonna say, we're not taking Medicaid.
Well, to now, and I have for the past 8 years, I guess, or whatever, I put $204 a month for mine, and that's just my supplemental.
Supplemental.
It doesn't cover, the other 100. So,
For
what is
prescription.
gonna happen? Is it gonna go out of sight? What do I do? I'm with ARC now. I had a blow up with them today and told them how
Right.
nasty Obamacare was. I probably would get a thank you letter from them. What do I do? Where do I go to get insurance? That's my question. How do I get out of ARC
Right.
to go buy insurance?
You're sitting
I
next
don't
to
think
it.
right now, the Medicare premiums on supplements are not gonna go up. Where you're gonna see it eventually touch
Yeah.
people that have Medicare Advantage plans, because they're gonna start, right now, the government subsidizes those. And they're
Oh, yeah.
taking money away from Medicare to go toward the Obamacare.
Oh, I know.
They're gonna cut what they're giving to Medicare Advantage plans, so they're gonna start going up on
Yeah.
those.
You're gonna have much longer lines. You're gonna be sitting much longer in
And
waiting
they're gonna cut
rooms.
what they pay to the
You
doctors.
know, you're not gonna,
Oh, I know, there was one program that they came out with, oh, you don't have to pay any premiums and blah, 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 and everything that they were advertising. And my doctor, and this was last year, they canceled every patient they had. They said they were no longer taking that insurance because they didn't want them. But it's scary.
yes, sir.
Business owners, got a very small group that's comprised of just the 4 partners.
Right.
And we have a private group policy. What does all this mean to us?
Well, I mean, your agent should have called you about renewing early.
Yeah.
And I would probably advise you to do so.
Actually, for what I understand, he called earlier to say that our insurance company is not going to be insuring anyone in Georgia anymore.
Are you with Mutual?
Medical Mutual.
Medical Mutual?
Yeah.
Yeah, they're out of state. They pulled out of state.
So is that, are there gonna be less insurance companies, which is less options?
Competition.
Less competition means higher premium.
Yeah.
So who's gonna be left in Georgia offering this?
Didn't
Protection.
somebody else just recently pull out too?
Well, Medical Mutual was mainly brought in by Northeast Georgia to handle Northeast Georgia Hospital, doctors group there.
But no, there was just one of them.
You
I
would
heard
think,
the other
you're
day
talking
that
about
they pulled out.
Aetna pulled out of several states, but
Aetna's not on the exchange.
How
Who's
many
on the
companies are in the
exchange?
exchange?
Blue Cross,
There's
Kaiser.
5 on the exchange.
they were in some of the
Blue
state
Cross, Kaiser,
exchanges, but they pulled
Humana,
out.
Alliant and Peach South.
Right,
Yeah.
that's the federal
There's 2 that I've
exchange.
never
That's the
heard of.
federal exchange.
Yeah.
But they were,
But
they were in. some
So
of
to
the
answer
state
your
exchanges.
question, sir, I mean, you can look at individual products for each of you, not through the federal exchange, but since you work, you probably don't qualify for that, but on the individual exchanges, or you can look at group health. I mean, you can run a quote right now. So I could run you a quote today with a December one, and then as soon as I get the rates for January, I can run you what January, and you could So if you renew in December, I could still change you in January. It just depends on what's going to be better for you. Chances are, I'm guessing, and this is a guess, but I'm thinking you're going to like what you have a lot more in December than what's coming down the train in January.
So your early renewals, have you seen them higher or same or?
The early renewals, it's a renewal, so they know what the rate is, and they're always higher. I mean, you don't have rates go down. But a 5% increase versus what's coming is,
Take your 5 now and
take your 5 now and
your 40
be
later.
happy you got the plan you want for another,
December of next year.
till next December, yeah. It's gonna be trickiest on the small groups. I mean, it really is. Individuals, it's just gonna be a price thing, but the groups is where it's gonna be trickiest, especially the smaller groups. Yes, sir.
First one said Medicare Advantage is gonna continue. How will it change?
We're not seeing any dramatic changes. They're like I said, they're taking 40 to 50. I think it's million. It might be billion. Maybe
It's
it's
just a
billion.
decimal point.
It's just another zero. It doesn't really matter. The point is, they're taking money from. He doesn't like it. All right, the commander in chief. You know, because he knows so much about health insurance. He doesn't like that. He'd like to tweak it down, but there's so many people on it. And it's been doing so well, you know, that it got to be a real battle there for a while, and so, you know, things are constantly evolving in this whole process. So what, you know, the big hope of all this is, what's the one thing that you see that motivates people to politics more than anything else that you see locally? It's school rezonings, because it hits them all, and you're going to see people really start to pay attention now, because they're everyone. The minute you go to a doctor and you have to wait 3 hours, there's going to be so many people that are used to going in the door and in and out in 20 minutes, you know, or at least getting in the room. And that drives me crazy. There's going to be a lot of people that are going to be just hopping mad. And then the rates are going to be the other deal. So if you're 250 and below on the federal poverty level, you're going to be probably pretty happy. But your lifestyle's not changing. You're still dependent on the government. But for those of us that are above that, you're going to see some dramatic changes, and none of them are going to be good. And hopefully it'll wake some people up to paying attention and reading the stuff before you pass it. You know. All right. Yes, sir.
So you probably won't have the answer to this, but my concern looking at this because I don't know if anyone has the answer to this, but looking at this down from the Capitol from a tactical position, my worry is we here in Georgia have done everything we can do to stalemate it, to not facilitate Obamacare coming in. Is that we get to a point where it's implemented, but it fails, and the system implodes. You got doctors who won't accept it, you've got people who aren't signing up, and then you have a completely dysfunctional system. That's the worry. Then what?
Good grief.
Well, my answer to that is that was always the intent.
It's to be a.
That's
single-
2008
Then
in
big government
financials.
comes in.
That's right.
That's
Single
2008 in the
payer. They come in
financials.
and they
I mean-
put single payer in place. That's what the
That's
plan
what
is.
he always wanted.
I mean, I like to think that I'm being a doomsdayer with that thought and that it's not going to happen, but when I look at this, I mean, it's just so crazy.
Say something.
You know, I mean, it's nothing in here from a business sense makes any sense, other than no limits and the underwriting part. I mean, look, he could have easily have come in here and tweaked a few things and made a very good system great. And it would have helped maybe not, 35 million, but 15 million. And the other 20 probably wouldn't be left alone by the government. And instead it had to be this big political grab. And if that happens, what happens when all hell breaks loose and everything goes to disaster? The healthcare reserve will step in, and there will be QE1, and QE2, and then we will be on a true socialism healthcare, and I will be unemployed.
I have one more question.
Yes.
Speaking of unemployed, what about the navigators that the government's talked about?
Well, the Georgia Insurance Commissioner.
Yeah,
making them
so we
licensed.
voted on that,
Yeah.
and it was, I voted no, but it was approved, but then Ralph Hudgens, our insurance commissioner, said no to the navigators. There was an interesting argument that came up that even really conservative people approached me, reps, and said, these navigators, if we don't handpick them, then the Obama administration is going to pick them. I just couldn't get comfortable with that still. I couldn't approve something that was going to facilitate the process.
But the insurance commissioner is licensing people.
He's setting up a process where he's able to, well,
He
kinda
told
spoke out
us
of turn a little bit,
it
but
was going to be the same test as a life and health agent, but it wasn't going to be considered a
I was
life.
going to change the name at the top of the piece of
Yeah.
paper.
It's called a navigators, and it requires 35 hours of CE education on the insurance side, and then another 20 hours on the federal side. And it requires a licensing exam and pass the test to get that navigator's license. I was in a luncheon last week with Commissioner was there, and as of last week, you know how many people are licensed navigators in the state of Georgia?
What's the definition of navigators?
It's an insurance agent that doesn't make commission. They're paid by someone else other
Or
than a
a
commission.
grant, or
A grant, or
Acorn, or whoever they work
whoever. There's
for.
four
But in other
people.
states, they're letting just people off the street being navigated.
Right. So in Georgia, the commissioner said that they can't, that they have to have the qualifications to be able to do this. The University of Georgia is hiring 25 navigators for the purpose of signing up kids, young people, to get that offset of premium. But if they're gonna be subsidized, I don't understand how that whole math works out. You're not putting any new money into the system. You're just saying we're gonna subsidize 93%, whatever you said, of that. That doesn't make
And
sense.
the backstory to the University of Georgia piece is that they accepted a $1.8 million grant
Do the computer.
from the Obama administration to start to facilitate it, because the White House can't find any supporters here in Georgia. So they went in through the back door, and Jason Spencer, a representative from South Georgia, I don't know how he found it out, but he did. And we've all joined forces because we approved that budget for the Board of Regents, and we voted no against it, so it's a back door into there. So we're trying to get the governor to repeal the $1.8 million.
And that was to build the
It was the
computer
infrastructure.
infrastructure.
Yeah, yeah.
Right.
The technology infrastructure behind the scenes, because they can't get support from us anywhere. We're not letting them have access to any departments, and they found the weak spot, not necessarily, it was just the Board of Regents, the college.
I mean, there's definitely going to be some positives.
Somebody to bribe.
There's going to be some positives out there for people that don't have insurance getting insurance. There's going to be positives for people who are uninsurable to get insurance, and that's what you'll see on the media every night, is, you know, the tale of that. But the reality of it, for the masses, it's going to be very, very disgruntling. Yes.
I think we lost the battle on that, though, when we let them define it as health care, because everybody in America had health care before this. They just didn't have health
86%.
insurance.
There you go.
But you could get care, they couldn't turn you away. I mean, they're not gonna turn you out of an ER if you're bleeding.
When you
Anyway,
when
that
you
wasn't
hit
what I
those
wanted.
out-of-pocket maximums, trust me, those non-for-profit hospitals will be knocking on your door
Well,
on that money.
it's no worse than what we're gonna have when this all comes through, because docs are getting paid less, they're gonna do less, they're gonna drop out. I mean, it's not just waiting in waiting rooms, you're gonna be waiting 3 months to get in to see the doc. I mean, that's what I'm worried
Right.
about. This is what I wanna ask you, is there still a way to just buy catastrophic coverage, or they're not gonna let you do that anymore?
They have a catastrophic plan for the young people to avoid the mandate.
For the young people?
No.
What about the rest of us?
I went to one meeting, and it's just one time.
Trust me,
but they
most
have
of those plans
catastrophic
are what I
plan.
would
You
call
have to be
catastrophic.
30 or younger to buy it.
30 or under.
But the age is on the honor system.
We'll buy that.
There you go. I'm 30.
So you don't have to.
Because the thing that Jeff was saying about when this all implodes, I mean, I guess
Well, the income.
my biggest hope, and maybe this is just impossible, but is that at some point, we go back to, almost like you have car insurance, like you have something catastrophic for if you have an accident, but you don't expect your insurance to pay for your oil change or pay for your new tires, or, like you pay for all that stuff out of pocket, all your regular stuff.
I mean, if you're remotely healthy and
And that
you
would
get
be,
a cough or
I
a
mean, it
cold,
would be so much cheaper. Healthcare would be so much cheaper
Yeah.
that way. It'd be fee for service primarily.
you're going to go to any pharmacy you can to buy what you can to avoid going to the doctor's office.
Yeah.
Because you're going to have to sit there forever, and it's just going to be standing room only. It's going to be, I mean, it's just going to be like going to the emergency room right now. You know, it's gonna
Steve,
be.
have they still, my understanding was that they tied the doctor's licensing to Obamacare so that they could not do concierge services? Is that what you understand? So that would eliminate doctors, taking cash only?
I have not heard
They
anything.
haven't, but I'm sure that, I don't think they have yet, but that's coming.
Hasn't occurred.
I'm pretty sure that's coming.
That's
Well,
what
the
physician-
government.
They have mandated, I've heard like one thing they mandated, that all prescriptions now must be done on an e-prescription electronically. And there are many, many pharmacies that don't have that capability. And, there's a lot of things that, when you're sitting in Washington DC, justifying your job, coming up with the grand plan, it looks good on paper, but in reality, they haven't thought it out real well. And it's, by June of next year, it'll be real interesting. But next year we have an election, so I'm hoping this wakes a lot of people up by the time the elections roll around, and maybe we can just boot them all out, because that would help
Wouldn't it be
tremendously.
fun? Picture this, him in the White House, and everybody else is Republican, and he's the only Democrat there. Can you imagine how upset he would be?
But we had a chance to get him unelected last go around, and he got reelected. So
Well, we had too many Republicans that were, I don't want that one.
well,
They thought, instead of going and biting the bullet and voting for him.
what was the presidential turnout? 33% of voters.
Yeah.
It wasn't very much. 33% decided for 100% of us,
Yeah.
and even that was very, very small. And
Not to mention 125% of some precincts in Philadelphia.
Yeah.
That's why I hate these ballot questions and stuff that they like to put on there. Would you like a bigger government? Would you like a new courthouse? They put that on there. Well, only 33% are even voting, and about 30% of them have no idea what they're talking about, or what they're voting on. They're just voting. So 3% of them are pretty on top of the issue, and then the other 30% are just showing up to do their duty, but they haven't really researched
They pay for
it.
in some places.
And I think that's an interesting point, because we can reelect new people all day long, but until the mentality of the people
Yes.
changes and stops saying, give me, give me, give me, give me.
Absolutely.
Because what will happen is those elected people are gonna say, well, that's what I have to do, they justify it wrongfully.
I'm hoping this is the great
We're gonna
wake-up call.
continue to change that mentality of people.
But they
Well-
continue to foster.
Carol.
What do you think about Tom Gray's bill? I was wondering what the response is going with that. And also, I'm the eternal optimist, and I still think there's a way to fight this. Herman Cain's got a website. If all of you went on it, it goes directly to send faxes to all the senators and congressmen that, I'm told that makes a difference. You tell me if it does. I don't know, but I think if they hear from the people.
It's good for them to hear.
And the Tea Party group is supposed to be the grassroots of the country. We have got to stand up and tell people, we don't want this.
What's the website?
HermanCain.com.
Okay.
But you're talking about HR 66?
The Tom
Tom
Gray's,
Gray's,
The
yes,
defund.
yes.
Yeah.
Yeah, it's defund
Yeah,
Obamacare,
and to
basically.
your point, the emails and phone calls absolutely helps. In DC, the way they do it, I mean, they get thousands and tens of thousands, and they have interns that log the calls, and at the end of the day, chief of staff will say, you got 760 calls against this today, and you got 10 for it. And that starts to shape what they're thinking, because, their worst trip, a lot of those folks' worst trip is when they get on that plane and they fly home and they know that barbecue they're going to the next morning.
They're gonna get barbecue.
They're just
gonna
gonna
get
get fried. And that's good. You want them to
They're
have
going on
that
the
hesitation, or else they're institutionalized.
They'll be on track.
One last question.
Unintended consequences, you've seen, I'm not sure it's General Motors, but UPS, they're all sloughing their retirees off to exchanges. So is
IBM,
that something that
IBM did that too.
planned, or is that going to cause a real problem in funding that the Swamis in Washington never even thought about?
I don't think they thought it out at all, but, the UPS did away with all dependent coverage unless your dependent doesn't have coverage, which was huge. I mean, that's 100,000 plus employees on a very, very rich plan. Well, that was unbelievable. And you're seeing a lot of that happen. Yes, ma'am.
To be fair, we worked for a global company and they did it probably 2 or 3 years ago.
Yeah,
If you were eligible anywhere else, you had to pay.
Yeah, they've been doing that in the
$1,000
private
to stay
sector
on
for a
there.
long time.
Yeah.
And I don't know I've never heard an explanation of what they saw in the Affordable Care Act that caused them to do that. I think, like you said, it's probably they don't want somebody being on the exchange and then they're also riding UPS for theirs. So you can be on it as a dependent. You just can't have it with another employer or have individual coverage somewhere else. So, but it was pretty dramatic. McDonald's.
They're
I mean,
shifting a lot of people to
here's one.
part-time, too.
I mean, if you work for the school system right now, and you work in the cafeteria, or you drive a bus, you're probably doing it for benefits.
That's right.
All right? So the school system has a choice now. They're going to be losing drivers and losing cafeteria workers who now can get their own coverage. They no longer need that job. It's not the income. Or if you want me to keep on driving or working here, you need to pay me some real money. So, I was talking to the superintendent about that, and he's faced with that reality. So my suggestion to him was look at how long they work. There's no reason if they don't need it, once this goes into place, they don't necessarily need to be full-time to get benefits. They can get benefits elsewhere, but you could pay them more. Because that's what he thinks. So he was going to pay them more and give them benefits. And I'm like, I'm sure Hal would like that, but sorry. I did put in a good word for you for driver of the year. But I mean, this is going to affect everyone. I mean, there's just so many things that it impacts. And hopefully this will be the great wake-up call and people will get off the couches and start paying attention to politics because it affects everything we do.